you start looking at race, and that intersects with socioeconomic status, where we have higher risk for less well-off communities. And then we know we have less well-off communities living in rural areas. So you start to see this intersection of these factors. You just look at, how that starts to stack up, factor after factor adding up.
There are key groups that we know all states address, but I really encourage them to dig into the data and identify those disparities. Because if they identify the disparities or they identify high-risk populations, that's when they have the information to do something about it.
Welcome to this Children's Safety Network conversation about preventing child drowning. I'm Jennifer Leonardo, Director of Children's Safety Network, or CSN. CSN is a project of Education Development Center and is funded by the U.S. Department of Health and Human Services through the Health Resources and Services Administration's Maternal and Child Health Bureau. In 2021, 380 children under 15 years of age drowned in the United States, according to data from the U.S. Consumer Product Safety Commission. That represented a 12% increase from 2020, when 339 fatal drownings were reported. Each drowning death is preventable, and sadly, drowning happens more frequently in some communities than others. The CDC has found that drowning rates of Black children ages 5 to 9 are 2.6 times higher than that of white children of the same age. For Black children ages 10 to 14, the rate is 3.6 times as high. And in swimming pools, Black children ages 10 to 14 years drown at rates 7.6 times higher than white children. To save lives, states and jurisdictions should examine the disparities in drowning in their own states, and then build prevention programs accordingly. In today's episode, I talk about the intersection of child drowning prevention and health equity with two guests. Morag McKay is Chief Research and Network Officer at Safe Kids Worldwide, a nonprofit dedicated to protecting kids from preventable injuries. Morag is a longtime advocate for drowning prevention and was instrumental in drafting and implementing the United States' first National Water Safety Action Plan. Rebecca Bishop is a prevention specialist at Children's Safety Network, where she applies a health and racial equity lens to issues affecting the health of young people. We discuss why drowning prevention must be examined from a health equity perspective and highlight some of the good work being done in the field. Morag and Rebecca, thank you so much for being here today. An estimated 950 children die by drowning every year. I'm curious which communities are most affected by these drowning deaths and why. Morag, would you be able to speak to this?
So first of all, if we even just look at age, we see differences in risk. So very young children, particularly those under the age of 5, are at increased risk of drowning. In fact, drowning is the leading cause of death, not just unintentional injury death, but leading cause of death for that age group in this country right now, which is a pretty stunning statistic. And then, of course, as they get older, they're roaming further from home, so they may be drowning more in open water than in a pool. But certainly, there are age differences that we have to take into account when we start thinking about drowning.
Thank you, Morag. Rebecca, what would you like to say about this?
The data really shows that Black children and Alaskan Native children drown at significantly higher rates than white children. For Black children, it's 7.6 times that of white children, as an example. This disparity is connected to a number of things. There are things like economic barriers and cultural norms, as well as even historical segregation in swimming and water safety education that impact these populations. At one point, Black and white populations, it was illegal to swim in the same pools. And after segregation ended, a lot of the pools in the Black community closed down. We also know that water safety education does not exist in the same prevalence or amount that it does maybe in areas where swimming is part of the culture.
And it's really interesting, we look at those different pieces separately, but what I think makes this such a wicked problem to begin to solve is that there's an intersection between those different factors. So age is important. We need to sort of understand development stage and the risks associated with that. But then you start looking at race, and that intersects with socioeconomic status, where we have higher risk for less well-off communities. And then we know we have more less well-off communities living in rural areas. So you start to see this intersection of these factors, and you can, weave in even more. Think about, disabilities amongst children. We know, for example, that children with autism or other neurodivergent children are increased risk. And if they're living in a rural area and they're children of color and they're young, you just look at how that starts to stack up, factor after factor adding up, making their risk that much greater, and therefore requiring even more careful thought as we start to think about how do we begin to ensure that the preventative measures that we're putting in place are meeting all of those needs.
So you were just speaking about access to water safety education impacting rates of drowning. How does access to swimming lessons or water safety education vary among different communities?
There's definitely a historical lack of access to swimming lessons and to pools. There was segregation for many years in this country. So white pools and Black pools. And when some of that ended, what actually happened was they just closed the pools that Black communities were using. So we actually have a pool shortage in this country, but that lack of access for decades led to cohorts of families where people didn't learn to swim. So we certainly see now when we're talking to Black families that often the parents don't know how to swim. And if the parents don't know how to swim or are afraid of the water because they don't know how to swim, often they are not necessarily getting children into swimming lessons. But as I said, even if they want to get children into swimming lessons, there is a shortage of pools. If you look at where the majority of Black children drown versus white children drown, when we're talking about pools, for white children, it's in their residential backyard pool. For Black children, it's more likely to be in a community pool. Something else we're coming up with recently is a shortage of lifeguards and swim instructors. If we have that shortage, those pools are not going to open, or there's going to be competition for where those kids or young people that have the skill sets to teach swimming or to lifeguard go. And the likelihood is they're going to be paid more highly in some neighborhoods than they are necessarily in some other neighborhoods. So it's very complex. It is multiple issues that are going to have to be looked at to begin to address this. But there are some beautiful programs out there now that are starting to even just exposing some families to the whole idea that water recreation should be part of their life.
Morag, you have a lot of experience in this area, and I'm curious, what drew you into this work?
Well, I am a near drowning survivor. And I think that's one of the reasons why I'm so passionate about this issue. I was right in that below 5 age group. I was almost 4 years old, and I followed a beach ball into the river, where it was a big sweeping bend in a river where it shallowed out and slowed down, and that's where everybody swam. And I followed the beach ball in, and nobody noticed me right away. And so I was underwater, and just at the point of starting to panic when somebody scooped me out. So it took a long time for me to learn to swim after that, because I was afraid of the water. But having lived through that and gone on to love being on the water, still not crazy about swimming, but I am an avid paddler. So for me, that I think is one of the reasons why I'm so passionate about this issue, because I do understand how quickly it can happen, and how important supervision is as a result, and how important it is to learn to be safe in, on, and around the water.
Rebecca, I can hear how passionate you are about drowning prevention. Could you share with me some of the reasons that you started working in this area?
So I too am a near drowning survivor. I was 10 or 11. At that point, I did not have a lot of experience in pools. In fact, it's probably one of my earliest experiences with pools. And I remember my parents were watching. They were supervising us at the pool. We happened to have one of our babysitters there. And I remember thinking, I wonder how far the deep end goes. I knew I couldn't swim, but I thought, for some reason, I didn't realize how quickly the drop down went to the deep end. And I remember before I knew it, losing control and being underwater. And before I could say help or anything, I was under. So if it was not for my babysitter who saw me, before I knew it, he brought me out of the water. And I remember how much it really, really scared me. If I think further down in my life, when I was a teenager, we ended up having a pool at our home. And I remember the various steps my dad used to take to make sure. He used to give everyone a swim test if they wanted to go in the deep end. He used to kind of give everyone a speech about what to do if you're in trouble and how to alert everybody. And I do think it was because of my experience drowning as a much younger kid. But in my community, I also don't remember any type of education about drowning prevention. And so I think part of what I think about what makes me passionate about this is about remembering that cultural context, right? That people need education that matches the environment that they live in. And I also think about culture and subcultures, right? And the importance of connecting to people's norms and values, right? Connecting that education to norms and values so people can receive it. It is extremely common in the city of Boston, where I live, to hear of young kids that drowned in beaches, going to bodies of water with camps. And not only am I thankful that, my parents somehow got informed after my experience, but I think all parents need to be able to have that conversation with their kids, no matter what's happening.
I really appreciate the authenticity and the courage that you both have in sharing what took place and how that has channeled into positive and committed work in this area. I think it's an exciting time in the United States in that we are now having our United States National Water Safety Action Plan. Morag, can you tell us more about the plan and some of the recommendations that are in it?
So the plan was developed over a 4-year period with input of hundreds and hundreds of stakeholders across the country, and it was launched about a year ago. We are calling on communities to look at their particular drowning prevention issues and develop context-specific, data-driven, and evidence-informed plans to begin to address any gaps that are found as they go through that reflection process that I was talking about. To support them in that, we've developed almost 100 action recommendations. Some of those are more specific to the national level, some to the state level where legislation would come into play, and some more at a local level where we're talking about building the infrastructure and opportunity to teach swimming lessons or to do water safety education. But again, the plan is it lays out a framework and essentially puts out that call to action that things are different enough in communities, context is important enough that we really do need to look at from a community by community perspective. Lots to be learned in sharing what each community is doing, but each community needs to look at their own data and decide what resources they have and what partners are willing to work with them and decide what can be accomplished.
Thank you. Rebecca, could you speak to how Children's Safety Network is addressing inequities in drowning?
Drowning is certainly one of CSN's priorities. CSN has a webpage with information about drowning prevention, along with a number of publications, infographics, webinars focused on available data, drowning prevention facts, information about disparities like we're talking about today, and then information about evidence-based programs and strategies for states or anyone else that's interested in the issue. Jennifer, you just mentioned the Learning Collaborative. CSN, in partnership with HRSA, facilitates the Child Safety Learning Collaborative. And that collaborative brings states and jurisdictions together to advance evidence-based policies, programs, and practices at the state and local level to ultimately reduce fatal and serious injuries among infants, children, and adolescents. And I believe next year, 2025, drowning will become one of the topic focus areas of that collaborative. The other thing I'll just say finally, which I think kind of adds to the breadth of what CSN addresses on this issue, is CSN also facilitates the Child Safety Now Alliance, which brings together leaders and experts representing various national organizations. this group also focuses on drowning as a topic, which is a great way to hear from not just the leading experts, but to stay on top of issues that may not be on the radar or issues that are kind of emerging issues that are important.
And I think those partners, that partnership through the alliance is also amazing because it brings together a number of partners specific around drowning prevention or that are part of other networks that are dealing with drowning prevention. So for example, if the community is looking for resources, the National Drowning Prevention Alliance has a toolkit that is readily accessible and can be used. The American Red Cross has Whale Tales teaching curriculum that is for free and for use. So, it helps us identify some of these resources so we don't have to recreate the wheel, particularly when we're talking about water safety education, both for kids, but also for families, parents. And I think that that's one of the wonderful things about a network like that is you just learn about all the breadth of what is out there that can be used by communities.
That's a great point, Marag. Thank you.
I'm wondering, for Title V agencies working in drowning prevention, what recommendations would you have for addressing the intersection of social determinants of health?
I really think about digging into the data, particularly at the state level. I think there are key groups that we know all states address, but I really encourage them to dig into the data and identify those disparities, those communities that you may not see when you first look at the data. Because if they identify the disparities or they identify high-risk populations, that's when they have the information to do something about it.
And again, I think Title V agencies, because of where they're located, right, within government public health, can play such a role as a convener. They do that for a lot of different issues. And if we're really looking at encouraging the development of action plans, whether that's at a state level or providing support for local level plans being developed, to your point, having data is really important, but I think they can also be agitators and instigators to getting some of this work going. And often these community efforts really benefit from having the support of a group that has facilitation skills, that might know how to do a brief survey, some of these other things that would be really helpful to pull together the information in a community to help begin to identify what the issues are for a particular community or state, and then start to look at potential solutions.
Other strategies that I think about are, increased education to some of these high-risk communities that Morag talked about. Education about awareness of drowning risks and preventative measures through community events. Even schools or pediatric settings would be great. I think about developing and distributing education in different languages, right? To provide access to different cultural groups about water safety, and even telling communities, educating them that they are high risk and why they're high risk, I think gives them more tools in their toolbox to be safe. The importance of offering emergency response training, I think, is essential, especially in these high risk communities that may not have experience knowing what to do if somebody is drowning, knowing who to reach out to. I think also depending on how quickly emergency services can get to them, I think is essential. But giving people tools to know what to do and what effective responses can be.
That uniqueness that you're talking about is something that we focused a lot on in the U.S. National Water Safety Action Plan. It's context specific where you are. Your water sources are going to be different in each community. Some, as I said, they may have a river running through the community, or they may be near a lake. Others are in a part of the country where there's a pool in almost every backyard. So it really varies. So what we said was, each community needs to reflect on their context. What are their data telling them? What are their water sources? What do they already have in place? Who are the potential partners like you just talked about? So sort of trying to understand and create, or not create, but understand the picture of what is happening in your community is a great starting place to figure out what actions might begin to address your local context specific risks. And then, to your point about education, You may not have a pool, but we can still do dry land water safety education and teach people about the risks, teach them about what to do in the event of an incident that doesn't involve them getting in the water, right? Throw, don't go, these sorts of messages around safe rescue, that if we can intervene, we can prevent some of these tragedies where a child gets in trouble and parents go in and try to help them out, and you end up with multiple drownings as a result.
Are there health equity approaches you think would be helpful to address some of the measures you shared?
The one that Save Kids has been beginning to introduce is the injury equity framework that was developed by Dr. Sidika Kendi and Michelle Macy. It really does, from an injury prevention perspective, it's based on Hayden's matrix, which many people know, and it also builds in the socio-ecological model, which again, many people are familiar with. So you're not just looking at the individual level, but you're looking at the family organizationally up to the societal level in terms of things that you might do to start to influence the issue. But what it adds on top is it really starts to look at some of those social drivers that are related to things like poverty and race, disability. We know, for example, that neurodivergent children there's one study that says they're 160 times more likely to drown than the general pediatric population. So we know that there are some groups particularly at risk that we need to take into account. But you can sort of think through that matrix and focus on what might we need to do to address the needs of a particular group where we know there are disparities, and ensure that programming that we're building in is addressing those needs at best, but at least not making those disparities any worse.
Are there specific resources or programs you would like to highlight that are doing good work in this area?
I'd love to highlight Diversity in Aquatics, which is a national NGO that is working to address the fact that there are communities of color out there that don't have a culture of water safety right now. They do these water safety festivals that bring together all of the partners in a community that are doing anything around water. So it might be swim schools, it might be safety organizations, it might be people that teach you how to scuba dive or how to canoe or kayak. And they bring in families and they expose them to the opportunities that water might provide, but at the same time, they do educational water safety. They get them in the pool and actually have them experience what it's like to be in water. And for some of those kids, it may be the first time they've ever done that. They talk to the parents. They provide scholarships for swimming lessons. They provide equipment. Some kids don't have a swimsuit. They provide a swimsuit. The goal is to have everybody enjoying the water, but to be doing it safely.
Two resources that I think about when we think about affordable swimming lessons. One is the YMCA. They provide a really significant role in providing affordable swimming lessons and water safety education across the U.S., and they particularly focus on communities that lack resources and access. And then the USA Swimming Foundation, they have an initiative called Make a Splash. And that foundation provides affordable swimming lessons to children also across the country, with a particular focus on minority communities where the risk of drowning is higher.
The other thing that the Y is doing is they've started this approach where they're doing swimming lessons for kids and swimming lessons for parents at the same time. So it's essentially a family event timed so that the whole family's there swimming at the same time. And just making it that much more feasible and easy for a family to together learn to be safe in, among, and around the water.
Morag and Rebecca, thank you so much for joining me today to talk about drowning prevention. It has been an interesting discussion, and I'm enjoying learning more about the United States National Water Safety Action Plan. Thank you so much.
Thank you.
My pleasure. Thank you.
Thank you for listening to this conversation from Children's Safety Network. If you are interested in learning more about how CSN is advancing child safety across the United States, visit our website, www.childrenssafetynetwork.org.